Your nasal turbinates are structures that stick out from the inside walls of your nose. They're made of bone covered by a thin layer of soft tissue called nasal mucosa. The purpose of the turbinates is to humidify, warm and filter air as it passes through your nose. One of your turbinates may grow too large, usually the lowest one. If this happens, airflow through your nose may be blocked. The turbinate may be so swollen that it touches your septum, which is the thin wall dividing your nose into right and left sides. If medications don't relieve your symptoms, a procedure called nasal turbinate reduction may be done to reduce the size of the swollen turbinate. During the procedure, the surgeon will make a small incision in the mucosa on the turbinate. A tool such as a microdebrider will be used to remove soft tissue, bone, or both from the turbinate. In most cases, the surgeon will only remove enough tissue to improve airflow. The rest of the turbinate will remain. To find out more about turbinate reduction, talk to your healthcare provider. Our nasal turbinates are critical for the function of the respiratory system, as they help warm, filter, and humidify the air before it reaches the lungs. When one of the turbinates becomes enlarged or swollen, it can significantly impact your breathing, causing discomfort and even leading to sleep disturbances or difficulty in performing regular activities. This is particularly true when the swelling becomes chronic and doesn't respond to conservative treatments like nasal sprays or decongestants. In these cases, nasal turbinate reduction offers a viable solution. Nasal turbinate reduction is typically considered when other treatments have failed to alleviate symptoms. This surgical procedure aims to reduce the size of the turbinate, providing the patient with significant relief from nasal obstruction, improved airflow, and a better quality of life. Here's a closer look at the procedure and its benefits. Indications for surgery. Nasal turbinate reduction is typically considered when non-surgical methods have not effectively addressed symptoms. The primary indications for surgery include chronic nasal congestion, difficulty breathing through the nose, frequent sinus infections, and the inability to get relief from medications like decongestants, nasal sprays, or antihistamines. Enlarged turbinates can block airflow, causing discomfort, snoring, and interrupted sleep. If other treatments, such as allergy management or nasal irrigation, fail to provide long-term relief, a turbinate reduction may be the solution. Patients who suffer from conditions like chronic rhinitis, allergic rhinitis, or non-allergic nasal congestion may also benefit from this procedure. In these cases, the turbinates become swollen and hypertrophic due to inflammation. This swelling narrows the nasal passages, leading to breathing difficulty, which can affect overall quality of life. The surgery is particularly useful when the condition becomes severe enough to interfere with daily activities such as exercise, work, or sleep. Procedure options. Several techniques are available for turbinate reduction, and the choice of technique depends on the patient's condition, the surgeon's experience, and the specific anatomy of the nose. Some common methods include cauterization. This method uses heat to shrink the soft tissue of the turbinate, reducing its size. The heat destroys part of the tissue, allowing the turbinate to shrink, which improves airflow. Cauterization is typically done using a special device called a diathermy probe, microdebrider-assisted reduction. This technique involves using a small surgical instrument called a microdebrider that cuts and suctions tissue from the turbinate. This method is more precise and allows for more control over the amount of tissue removed, which minimizes trauma to the surrounding structures. Radiofrequency ablation. In this method, heat is delivered through a radiofrequency current to shrink the turbinate tissue. It's minimally invasive and typically performed under local anesthesia. It is a popular option for reducing the size of the turbinate without removing tissue. Submucosal resection. In some cases, a surgeon may remove a small portion of the bone or soft tissue inside the turbinate while leaving the mucosa, the soft tissue lining the nasal cavity, intact. This method is usually chosen for patients with structural turbinate issues. Minimal incision approach. Nasal turbinate reduction is generally performed using a minimally invasive technique, meaning the incisions are small and typically made inside the nostrils. This eliminates the need for external cuts and reduces the chances of visible scarring. Surgeons use specialized tools to access the turbinates without needing to make large incisions, which reduces the recovery time and minimizes the risk of complications. The procedure is performed with a high degree of precision. Surgeons may use an endoscope or camera to visualize the surgical area better. This technique offers the advantage of more accurate tissue removal and the ability to closely monitor any changes in the nasal structures during the surgery, local or general anesthesia. Nasal turbinate reduction is typically performed under local anesthesia, meaning the patient is awake during the procedure, but the area around the nose is numbed to prevent pain. Local anesthesia is often preferred as it allows for quicker recovery and avoids the risks associated with general anesthesia. In some cases, general anesthesia may be used, especially if the procedure is being performed in combination with other surgeries, such as septoplasty, for correcting a deviated septum. General anesthesia may also be used if the patient is anxious or has a complex nasal structure that requires more extensive surgery. The choice between local or general anesthesia depends on the patient's medical history, preferences, and the complexity of the surgery recovery time. The recovery process following nasal turbinate reduction is relatively quick, with most patients experiencing mild discomfort rather than severe pain. Swelling and congestion may persist for a few days to a week after the procedure. Typically, patients can expect to return to normal activities within 1-2 weeks. However, it is recommended to avoid strenuous activities or heavy lifting for a few weeks after surgery to prevent complications and allow the tissues to heal. During the recovery period, patients may experience some nasal bleeding, drainage, and a stuffy nose as the nasal tissues heal. The use of saline nasal sprays or irrigation can help alleviate discomfort and reduce congestion. Potential risks. While nasal turbinate reduction is generally safe, as with any surgery, there are potential risks and complications. These can include infection. Although rare, any surgery carries the risk of infection. Keeping the surgical site clean and following post-separative care instructions helps minimize this risk. Bleeding. Some bleeding is common immediately after the procedure, but it usually resolves on its own. Severe or prolonged bleeding is uncommon, but can occur. Damage to the nasal structures. If the procedure is not performed with care, there is a risk of damaging the delicate nasal structures, such as the mucosa or septum, which could result in further complications. However, the risk of this happening is very low when the surgery is performed by a skilled surgeon. Overcorrection. In rare cases, excessive removal of turbinate tissue may result in a condition known as empty nose syndrome, where the nasal passages feel too open and lead to dryness or a sensation of airflow loss. Surgeons typically aim to remove only enough tissue to improve airflow, without causing these issues. Long-term benefits. One of the most significant advantages of turbinate reduction surgery is the long-term relief it provides. Many patients experience lasting improvements in nasal breathing, reduced congestion, and better overall quality of life. This is particularly beneficial for people who have been dealing with chronic nasal obstruction for a long time. After the procedure, many patients report a significant reduction in the frequency of sinus infections and a greater ability to sleep comfortably without nasal blockages. If combined with other treatments for underlying causes, such as allergy medications, the benefits can be even more pronounced. Success rate. The success rate of nasal turbinate reduction is generally high. Many patients experience significant improvements in nasal breathing and quality of life after the procedure. Studies suggest that around 80–90% of patients achieve positive outcomes, with long-term relief from congestion and other symptoms. However, success can vary based on factors of various health symptoms. Success can vary based on factors of overall health, the severity of the condition, and other symptoms. In some cases, a follow-up procedure may be necessary if the turbinate regrows or if the patient still experiences some obstruction. However, these cases are relatively rare and, unusually, not being treated. For patients who are not candidates for surgery or prefer non-invasive treatments, there are several alternatives. These treatments are generally less effective in the long term, but may offer temporary relief. Some common alternatives include ghee, chai, Keegene, and a patient can choose one or other for the day. So adoption is not common. Nasal sprays. Decongestants, antihistamines or corticosteroid nasal sprays can help reduce nasal inflammation and shrink turbinates, providing temporary relief. Saline nasal irrigation. Rinsing the nasal passages with saline solution can help remove allergens, reduce swelling, and improve airflow. Allergy treatments. For those with allergies contributing to turbinate swelling, allergy medications or immunotherapy, allergy shots, may help reduce the severity of the symptoms. While these treatments can offer short-term relief, they don't address the root cause of the turbinate enlargement, which is why surgery may be necessary for long-term relief. Combination with other procedures. In some cases, nasal turbinate reduction is performed in combination with other nasal surgeries, such as septoplasty, which corrects a deviated septum, or functional rhinoplasty, for reshaping the nose to improve airflow. Combining these procedures can further enhance the results, providing a comprehensive solution for nasal obstruction. For patients with both a deviated septum and enlarged turbinates, a combination surgery can address multiple issues in one operation, reducing the need for additional procedures and allowing for better overall improvement in nasal function. The benefits of this procedure go beyond just alleviating congestion. By improving airflow through the nasal passages, nasal turbinate reduction can have a profound impact on the overall quality of life. Patients often experience relief from chronic nasal obstruction, improved sleep quality, reduced snoring, and a noticeable reduction in sinus infections. The ability to breathe freely through the nose again can revitalize one's daily routine, improve concentration and productivity, and even reduce the frequency of doctor visits due to respiratory issues. Moreover, the procedure's long-term success rate, with many patients experiencing lasting benefits for years, demonstrates its effectiveness in treating one of the most common causes of nasal blockage. While there are risks associated with any surgery, the overall safety profile of nasal turbinate reduction, combined with its high success rate, makes it a compelling option for those who have not found relief through other means. It's also important to note that nasal turbinate reduction is not just about improving the physical act of breathing, but also about enhancing the quality of life. For individuals who have struggled with nasal congestion for years, the emotional and psychological relief from this persistent problem can be just as significant as the physical improvements. The ability to breathe easily and comfortably through the nose restores confidence, improves energy levels, and helps patients feel more in control of their health and well-being. Then came the results from the trial. As we've explored today, nasal turbinate reduction is more than just a surgical intervention. It's a life-changing procedure that restores comfort and vitality to those who have suffered from chronic nasal obstruction. It's a procedure that not only frees up the nasal airways, but also opens the door to a healthier, more fulfilling lifestyle. If you or someone you know struggles with nasal congestion, snoring, or sinus infections that seem to never resolve, it may be time to consider a consultation with a healthcare provider. Discussing the options available, including nasal turbinate reduction, could provide the relief you've been searching for. Through advancements in surgical techniques and a better understanding of nasal anatomy, patients can now take control of their health and experience the benefits of clear, unobstructed breathing. In the end, it's not just about fixing a medical issue. It's about regaining a sense of freedom, improving sleep, and feeling more energized and confident in everyday life. So, if you're ready to breathe easier and live better, remember that nasal turbinate reduction could be the solution that helps you reclaim your health and well-being.